One of the challenges in our clinic is using retraction cords to push back the gums during impression taking, as well as for monitoring the tooth preparations. In this article, they examine one of the alternatives to conventional cords, namely PTFE or Teflon tape, in comparison to retraction cords, and they want to see whether it is acceptable to use Teflon tape instead of retraction cords or not. This article is a clinical trial published in 2023, which examines several factors including bleeding after removal of PTFE compared to retraction cord, as well as ease of use and the amount of gingival displacement. First of all, let's review together why we even use retraction cords in the first place. The use of retraction cord is especially important for margins that are at the gingival level or have been placed subgingivally. It's very important for us that the gingiva surrounding the margin is retracted so that we have excellent access, allowing us to take a reliable impression for a long-term restoration. If you look at the diagram as well, you can see that the retraction cord has been placed here and is positioned inside the sulcus. The gingiva has been completely retracted and the margin is fully accessible for impression material, polishing, or any other procedure. In the same way, if we take a good impression, not only do we record the margin very accurately and reliably, but we can also capture a portion of the gingival sulcus. As you can see in the diagram here, this helps us achieve better ditching during the laboratory stages and ultimately a restoration design with a better emergence profile. But why do we even consider PTFE? PTFE or Teflon tape has several positive features that make it a potential substitute for retraction cord. The first is that it is completely resistant to heat, so you can place it in an autoclave and sterilize it thoroughly. The second point is that it is chemically inert, meaning it doesn't interact with other materials, and it's also biocompatible, so it doesn't harm the tissue. The third point is that it's non-adhesive, so you can use it with a plastic instrument or a composite instrument. It doesn't adhere to bonding materials like composite, resin, or bonding agents, making it easy to use. Also, it's flexible. You can easily pack PTFE with a strip or your instrument and contour it as needed. The fifth point concerns its cost. You can easily obtain Teflon tape at a low cost, and it's also widely accessible in many places. There may be clinical situations where, for whatever reason, you don't have access to retraction cord, and the clinic can't provide it for you either. But regarding this study was conducted with 60 patients. 30 patients were treated using conventional cord, and 30 patients with PTFE. The duration for which the gingiva was retracted was 5 minutes. According to the results obtained, there was no significant difference between the two groups in terms of gingival displacement or post-removal bleeding. However, with PTFE, the amount of bleeding was numerically slightly higher.